What are 5 dog breeds I would never own as a vet? I've seen quite a few of these on TikTok already, but I just wanted to give my opinion. But remember, it is ultimately my opinion. You may disagree. The first of 5 for me is the Chow Chow. Now, I'm sure there are some nice ones, but I just find they often don't have a very nice temperament. They can be really aloof, and they're often very aggressive at the vets, but it's quite hard to fit a muzzle onto their face. They suffer quite commonly with a ton of eye problems, and their purple tongues are a bit unnerving. Unfortunately, number 4 is the Cavalier King Charles Spaniel. They are the loveliest dogs, and if I was going to pick a dog breed for myself, if it weren't for all of their health issues, it would probably be the Cavy, but they do have loads of issues. Pretty much all of them get the same kind of heart disease called mitral valve disease, which means that many of them spend their last days coughing and spluttering, struggling to breathe, and ultimately dying of heart failure. Okay, they've got to die of something, but in my opinion, breeding a dog with such a high probability of disease is not fair. Number 3 is the Dachshund, however you want to say it. They're really lovely dogs, and some of my favourite patients are sausage dogs, but 1 in 4 of them develop back problems in their lifetime. That can range from just pain to complete paralysis. This frequently means they have to have spinal surgery, which is obviously a massive undertaking and has a really long recovery period. Again, fantastic personalities, but just too much potential for heartbreak. Number 2 is the Shar-Pei. They even have a disease named after them called Shar-Pei fever. There are people breeding less exaggerated Shar-Peis, but most of them are too wrinkly. They're so wrinkly that they have to have their eyelids tacked in place so the hairs don't rub on their eyes. They're always getting skin issues. They've got tiny, narrow ear canals. At the vets, they're often trying to bite the face off of all the staff. Most of the Shar-Peis that I see have loads of health issues. And number 1 is basically any flat-faced or brachycephalic dog breed, like a French Bulldog or a Bulldog or a Pug. Society has normalised the fact that these dogs snorting means that they can't breathe very well. There are specimens of these dogs that are healthier than others, but they are so prone to so many problems. Spinal issues, skin problems, eye problems. The fact that over half of them have to have a cesarean to give birth is enough of an ethical issue for me to never want to have one. If you're okay with that, that's fine. But for me personally, it's not very fair.